Um, when I first heard about this series of inspirational stories, the first thing that came to mind was all the stories of patients who had touched me deeply, those patients that made me smile, and those patients that made me cry, and those patients that had an incredible impact upon my life. And they still have an impact upon my life. But the story I want to share with you tonight is not a great success story. Not by any means. It's not a miracle of modern medicine, not a miracle of technology. It's not a miracle of divine intervention. In fact, when this story happened at the time, I felt that I had failed. That I had failed to do the thing that I thought was the most important thing. And that's what that Dr. LaSalle Lafall, the Howard University surgeon, had said to me when I was a medical student at Meharry Medical College. And what he said was that you have the opportunity to give a patient back their most precious possession, their health or their life. And I felt I had failed in that endeavor. The story is very briefly that while I was on call at the VA hospital, my resident called me and he said, I have a 66-year-old man in the emergency room. He has an acute abdomen and I don't know what's wrong with him. Could you come see him as soon as possible? On my way to the emergency room, I'm thinking, well, a 66-year-old man, he's probably got, maybe it's appendicitis, maybe it's a ruptured gallbladder, most likely a perforated diverticulum. Can't be anything that bad. I get to the emergency room, I examine the patient, and all I can see is that he's in bad shape. We take him to the operating room, and when I make the incision, we open the abdomen. What we see is all his small intestines, from his ligament of Treitz to his ascending colon, was dead. He had embolized the entire blood supply to his small bowel. Now, as we're sitting there looking at this dead bowel, the resident says to me, what are we going to do, Dr. Weaver? And I thought, maybe the best thing to do for this patient is to close him, keep him asleep, and let him pass in peace. But I actually couldn't do that. So I said, we'll resect the bowel. So we resected all his small bowel and some of his colon. Took him to the recovery room. I went out and spoke to his family, and I told his family that it was a devastating injury and that I didn't know if he would be able to survive. This was well before small bowel transplantation was even thought about. And I knew that patients at his age would not survive long on hyperalimentation. So I painted a very dim picture. As soon as I got home, I got another call from the resident that said, Dr. Weaver, the patient has no pulses in his legs. I go back to the operating room and we amputate his right leg. Now I'm really feeling bad because not only have I taken all his intestines, but I've taken his leg off. And most of you know the story. 12 hours later, I'm amputating his left leg. So now I have a patient who walked into the hospital who now has no intestines and no legs. And every day I would make rounds on him, and I felt that what had I done? I had not done what I had trained to be, which was to be compassionate, caring, to make a difference in somebody's life, to save someone. What I had done had acted like a butcher. I'd taken his intestines and I'd taken his legs off, and I had to see him every day in the intensive care unit. Twice a day I'd make rounds. Twice a day I'd see his family, and I would talk to them and let them know that there was nothing else we could do. Finally, one night, I'm on call. At about 2 o'clock in the morning, after I finished the case, I went by his room. And I went by his room because I wanted to ease my conscience. I wanted to feel better about the decision I had made. And so I sat at his bedside And I asked him, I said, would you have preferred that I would have let you stay asleep and perish at that first operation because of all that you've gone through? And it was more than just the 3 operations of his intestines. I've taken back multiple times for wound infections and et cetera. So he looked at me, then he reached over and he grabbed my hand. And when he grabbed my hand, it reminded me of my father, who every time he had something important to say to me, he would grab my hand and hold it. And he would hold my hand as he talked to me. And the patient said, Dr. Weaver, I am so glad you did not let me die. I am so glad that you woke me up. Because what you have done for me is that you have given me what everybody wants. One more time. Just a little more time to say what I did not say or do before. A little time to tell my wife that I loved her and thank her for standing by my side. To hold my daughter, hug her, tell her how proud I was of her and how much I loved her, and asked her forgiveness for the times I was not with her because I had to work. He said, what you have done has given me peace, and you've given my family peace. So God bless you, Dr. Weaver. God bless you. Now, as I sat with his family at his funeral, I realized I had failed to do what I thought was the most important thing. That was to save his life or to make him better. But what I had done was to give some peace to him and his family. And I would say to you that 30 years later, I still am proud to say that I'm part of a profession, part of a community that can proudly say we're doctors. Thank you.